Everybody, it is time to talk about your best friend, folks. Yes, we're talking about your pets, and boy, everybody gets a smile on their face when they talk about that. And we have a very special guest joining us in the studio right now, Dr. Leah Bross. She is a veterinarian over at the Iowa Veterinary Specialties, which is located just off 63rd Street on what street?
Creston Avenue.
Creston Avenue. Had a chance to stop by your facility last week.
Beautiful.
Folks, you will be absolutely blown away. If you have a pet, this is where you want to take your pet because they have everything you can imagine to make sure your pet is taken care of well.
And including acupuncture as a service.
Yes,
so talk about kind of some of the ways that gets used on our pets.
I think probably the most familiar way people are acquainted with acupuncture is for treatment of pain. So muscle pain, arthritic pain, that's probably the most common use of acupuncture, but it's also used for treatment of, it can be used for treatment of other internal medicine type things or skin disease or gastrointestinal disease,
acupuncture
asthma.
For that, really?
Sure.
For skin disease, really?
Anything can be treated with acupuncture, yes.
Because that's going to be really, and I don't know to say popular, but something that's going to be very active here with the weather changing.
Sure.
I'm sure you see a lot more skin problems with pets, right?
Yes, definitely. So people don't know in the United States about the internal medicine use of acupuncture, but acupuncture has been used for thousands of years in China, but only since about the 90s in Western medicine. And so it's based on, if you're thinking about it in terms of Eastern medicine, the flow of energy through your body, which they call qi. And qi runs through meridians or channels in your body, and they have external points, which are your acupuncture points, but qi runs internally as well. So you can treat internal problems with external acupuncture points, yes.
I did not realize
that. Is this suitable for all animals, all pets?
All animals, including pets that I don't necessarily treat, like reptiles, birds, and fish. I don't know about fish; they live underwater. But reptiles, birds. I mostly just stick to dogs and cats.
Right.
And so, sure. What happens is you come in for an evaluation. We talk about your pet's condition, and then I research what acupuncture points would be best used for treatment of that condition. And then we see, dogs and cats are a little bit special from people. People can, you say, lay still and don't move.
Right, that's what I was just wondering about.
And for the most part, they will. Dogs and cats don't always comply as much. So, I usually start out with a set of points that I would love to do, and that list gets a little bit shortened by how much is tolerated by the animal.
Okay, let's talk again. I want to go back to the skin ailments being treated with acupuncture. Now, can you give me an example of somebody bringing their dog in, maybe bringing their puppy in that has some type of skin ailment, and pick out a skin ailment that you might diagnose that acupuncture would be able to treat that, or you think that acupuncture would be the best solution?
Well, one that's probably easy to visualize for most people would be when a lot of dogs have what we call a lick granuloma, so they lick a spot, and that tends to be down on towards their foot, and they just lick, and it gets really irritated.
Till it gets raw.
Till it gets raw and red and irritated. And so that can be a symptom of allergies. It can be a symptom of, sometimes it's a symptom of anxiety. Sometimes it can be a spot that's painful, like if they have arthritis. So one way acupuncture can be used is by putting acupuncture needles in a circle all the way around that lesion, and that helps stimulate the release of cortisol and good hormones, and it stimulates qi flow to that point,
pets. Wow.
and can help with healing of that, and with the nerve, because a lot of times they'll have, because they're licking at it, they have that itch scratch reflex, and so that can help alleviate that, and then that wound can slowly start to heal.
Gives it a chance to heal.
Gives it a chance to heal. In conjunction with, antibiotics and whatever. I like to use both Eastern
in combination?
Yes.
Is it something then you recommend that they come in on a regular basis and be treated for?
It depends on what the condition is. So if it's musculoskeletal arthritic pain that's chronic, yes, they would come in initially on a fairly routine basis of weekly or twice weekly, and then as we are able to treat the condition and the pet is feeling better, we can do as needed, until we're to the point where we call it like a touch-up or a
so they're at a happy point.
Yeah, they're at a happy point, and we do once every 6 or 8 weeks we do a tune-up.
Okay. So let's go from skin ailment, and you mentioned to, like, say you pointed to the hips, like with dogs that are getting older and they have hip dysplasia, or they have some type of hip ailment, and they're having a hard time getting up and down stairs, for example, or even getting up and down.
Yes.
Would acupuncture be a possible remedy for some of these?
Absolutely, and that is the most well understood. Western medicine has proven through MRI imaging and measuring of hormones that acupuncture is a very safe and effective mechanism for treatment of musculoskeletal pain. So it's actually, there's been a larger movement towards acupuncture since the opioid crisis, that not everyone's familiar with, but trying to move away from opioids, and acupuncture is getting a lot more attention now because it does work, and the National Institutes of Health have shown through studies that it works.
Now, if your pet has been on medication for, say, arthritis, for example, would acupuncture be able to decrease the amount of medicines
Absolutely,
around?
yes. I try to, I often have pets come in on multiple pain medications, and we try to wean them off of as much as we can, starting with the ones with the most side effects, and then maintain them. Some maintain just on acupuncture.
Really?
Some maintain on acupuncture and some other pain medications, depending on how advanced their condition is.
And another interesting service that you guys have there and offer is the hospice care, palliative care. So and it was interesting to the comparison between what we kind of perceive as hospice care and so forth, and what you guys offer there. Talk about that.
So the hospice and palliative care service that we are offering at Iowa Veterinary Specialties is kind of like a walking with a client and their pet through end-of-life care. So in human medicine, hospice is often thought of as a person going to a facility and having pain management until death occurs.
Right.
And in pets, it's not so much in a facility because people like to have their pets with them at home. So palliative care, it starts out with palliative care when a pet's diagnosed with a life-limiting disease, whether that's cancer or end-stage kidney failure, some of those life-limiting diseases, but their pet is still happy and active, and they don't know that they're sick yet. They don't know. Right. So it goes from the amount of care that what is done for the pet can be the sky's the limit. What do you want as a pet owner for your pet? What is your vision for their end of life care? We might be talking about weeks or months. And how can we assist through that care? Do we talk about fluid therapy at home, for example, kidney failure cats and giving fluids at home. We talk about pain management, acupuncture, other medications. We talk in detail about what does this particular disease mean for your pet, and what are the stages? What are you expecting along the way? And what can we do to assist in making life happy for your pet? So when appetite decreases, what can we do? When we have difficulty getting up and walking around, what can we do?
Right. Because that's hard. It's hard for people to see that happen.
It is. It is. And so the service is more, when you have so if you come to me and say, my dog is now having difficulty walking on my getting grip on the floor because the arthritis is so bad. What can we do for that? Well, you can put non-slip rugs down. We can put their toe grips on. So you put on toenails. You can put on grips. So you can put on non-slip. There's some products that can make the pads less slippery, so they can grip on the floor better. There are. So it's not always medicine, and it's not. Even more so not medicine, it's just advice and help with home management and someone to talk to about how to tell when the pet is starting to kind of work its way towards end of life.
To make their life more comfortable.
Make their life more comfortable and help them have more good days than bad. And you know, once those more good days than bad start declining and bad days are more than good, and we're just not able to work that balance, is when the conversation about how do I decide when it's time for euthanasia.
Right, the quality of life. How about that?
A lot of unique services you guys offer over there.
Now, if people want to get more information about how to get a hold of you, what's the easiest way to get a hold of you?
The easiest way is to give a phone call to Iowa Veterinary Specialties. The number is 280-3100. Thank you. I don't call myself
You don't call yourself very often.
Or IVSDSM.com.
Or stop by and check out your facility and see firsthand a lot of the services you offer.
And again, very impressed. The machines that you have at your facility are human quality machines.
Yes, they are.
And taking care of the most valuable member of your family. So
we are.
Thank you so much.
Thank you.
Thank you very much for being here.